Hi, everyone. Good morning and welcome. Thank you so much for being here with us for this second episode of House Calls, Real Docs, Real Talk. I'm Carrie Pena. So great to be back again with you this week. This weekly show provides an opportunity for us to come together to ask questions directly of the experts and hopefully walk away with answers to your most pressing issues. Last week, we had an amazing audience from across the country, in fact, around the world, and we are so glad to have you back with us again today. This show really is all about you, the audience. You can see I've got my phone right here. We're monitoring your interactions and your questions as they come into us live, and we hope to provide as much information during this broadcast and hopefully answer all of your questions. So if you want to hear your question read live on the air during our show, throughout the show, I will ask a few questions of all of you, the audience. It is simple to participate. Let me go ahead and dig into that information right now. All you have to do is grab your phone and text AHA live to 22333. That's AHA live to 22333. And while you're doing that, we want to go ahead and get started. And with me this morning is Dr. Daniel Jones, professor of medicine at the University of Mississippi Medical Center. Dr. Jones, thank you so much for being here.
Pleasure to be with you.
So as we are taking a beat and letting our audience get out their phones and interact with us, I want to just begin with you and why you think a show like this produced by the American Heart Association is so important.
Well, good, strong health information is always important, but during these unusual days that we're dealing with COVID-19 around the world, our access to our own healthcare provider may be more difficult than usual. And then we are uncertain about some of the health information. So much unreliable health information is available out there, both about heart disease and stroke and about the virus itself. And so it's really important that we get good, reliable information in the hands of our audience today.
And before we go any further, we want to go ahead and throw our first question out there so our audience can begin participating with us. We want to know, did you join us last week for this first ever episode of House Calls, or is this your first time with us? Once again, we'll continue to give you this number. You can text your response to 22333, or if you are just joining in and have not registered yet, text AHA live to 22333. And while we wait for some responses to come in, Dr. Jones, I'd like to just continue on your point about the importance of bringing this information directly to the audience and to people out there who are seeking credible information. So for you as a physician, what is your level of concern about misinformation? Because with social media, it can make it difficult sometimes to really find out what's fact and what's fiction.
It's a real problem. It's always somewhat of a problem, but particularly in this time of dealing with COVID-19 is particularly a problem because there's so many sources of information. And frankly, you know, there's a lot we're learning about the virus. There are things that we don't know, we don't understand about the virus. And so the information, the reliable information changes from day to day and week to week. And so it's critically important that people look to reliable sources for the information that they need, both for their own health and for their families.
And you can see on the screen there, we are starting to hear from the audience. It looks like right now about half and half. Half of you were here last week, and then, well, right now it's changing a bit. As I said, this is real time. But nevertheless, we are so happy to have you if you are returning or if this is your first time joining us. And with that, we want to move on now to health in the headlines. And today we are opening up with health in the headlines. Each week we will select one headline that has grabbed our attention and we think that you, our viewers, would appreciate clarity on, and we will ask our expert to weigh in here and get his thoughts. So let me set the stage here. This week's headline is coming from CNN Health, and it reads, WHO clarifies comments on asymptomatic spread of coronavirus. There's much unknown. So there's the headline. Dr. Joan, if you would please kindly tell us your thoughts about that.
Well, this is not one of those sources of misinformation exactly. It was a source of misunderstood issues about the virus by the experts. And in the early days of the virus, there were experts who believed that transmission didn't occur from asymptomatic people. But we've learned since then, the health community, the science community has learned since then that indeed there are people who carry the virus, who aren't sick themselves, and who can transmit the virus to other people. And this is particularly true of children and young adults. They may have either no symptoms or very mild symptoms, nothing more than a cold, and actually have the virus that they can transmit to other people. And I think we're seeing some evidence of this as social distancing is changing and we're opening things up, and rates in some states in the US and in some countries are beginning to go back up. And part of this is because people who don't know they're sick are carrying the virus and going to public places, and then people are getting that virus from them through asymptomatic transmission.
And now we want to move on to You Asked, We Answer. In this You Asked, We Answer segment, we focus on your questions, and each week we ask you to submit your questions at heart.org/housecalls to have them answered here live on the show. And last week we talked about whether it is safe to go to the ER in the midst of COVID-19. And the message from our expert last week, the doctor we spoke with, was unequivocally yes. If you are experiencing any emergency, please do not hesitate to call 911 and go directly to the ER. This week, we are shifting our focus on how patients can stick to their treatment plans in the face of this ongoing pandemic, COVID-19. So, Dr. Jones, let's go ahead and look at some of the questions our audience members are sending in to us as I shuffle my papers and try to make sure I keep track of everyone who's interacting with us. Again, thank you to the audience for all of these great questions. So, question number one is from Derek in Miami. As a patient with heart problems, part of my treatment is regular exercise. Is it safe to go back to my gym? If not, how do I stick to an exercise program?
So it's a great question, Derek. Thank you for asking that. There are others in the audience who will benefit from understanding this. So there are really two issues to address here. The first is from a COVID-19 infection standpoint, is it safe to go back to the gym? My answer to that for patients is not yet. I think there's still too much risk for being around other people. And there are other ways we can get our exercise other than being in a gym setting. And so if your concern is, am I going to be infected? I think the safe thing is to find some other place to exercise. If you're sure what your exercise regimen should be, then just proceed with that, but outside of a formal gym setting. If you're uncertain about how much exercise and what kind of exercise you should do, then I do encourage you to make contact with your own healthcare professional. So these days during the virus, our ability to contact our healthcare professional may be different than at other times, but all of our doctors are making themselves available to us, sometimes through the phone, sometimes through online visits. But you do need to make contact with your own physician's office to be sure about the kind of exercise, how much exercise you should be getting to optimize care for your heart problem.
Very good. And thank you again to Derek from Miami. And now we want to move on to a question from Pablo in Tucson. By the way, I am broadcasting right now from Phoenix. And Doctor, tell the folks, good folks who are watching, where again you are at.
So I am in Hazelhurst, Mississippi. Mississippi, everybody knows Hazelhurst is a little town in South Mississippi. This is my home.
Beautiful. Thank you. And we'll move on to Pablo from Tucson. And Pablo asks, how do I know that my medication is safe to take in the midst of COVID? I've heard rumors that some medications may increase your risk of COVID. Doctor?
So, Pablo, I encourage you to ignore all the rumors and look to reliable sources of information about safety of your medications. So, for cardiovascular medicines, those medicines that prevent or treat cardiovascular disease, there have been rumors about certain drugs like ACE inhibitors that may not be safe to take if you have COVID-19. Those have not borne out to be correct. The American Heart Association recommends that people who are taking blood pressure medications continue to take their blood pressure medicines, their cholesterol medicines, and best we know, none of those medicines have been found to be unsafe. Look to reliable sources. Number one, your own healthcare provider, and number two, the American Heart Association, you can go to heart.org and get good, reliable information about heart medications.
And then we're going to move on to Rebecca in Texas. But first, I just want to thank a few of our viewers here. Inez Elliott says, thank you so much for doing this. Thank you for watching, Inez. Dina Johnson Rogers says, this is such critical information. I'm glad to be here, and we are glad you are here. Thank you so much for joining us. Katrina McGee wrote in and said, oh, good question about the gym. So we're so glad to have all of you with us as we continue on answering your questions live here on the air. Now let's go to Rebecca from the great state of Texas. Dr. Jones, Rebecca is asking, should I be worried about being able to secure my medications? I've heard that there could be shortages and thinking that I might need to stockpile.
So the answer is everything's fine. Again, rumors and rumors and rumors, but there's not any reliable information that any of the regular medications that we take to prevent or treat cardiovascular disease are in short supply. We're fortunate to live in a country where our medications are regulated, and there are agencies that assure that we have good supplies of medication. There are exceptions to that from time to time. And when the day comes that we do have a vaccine or we have a known treatment for COVID-19, there may be some periods of time that those drugs are short. But in terms of cardiovascular medications, no shortage of medicines, no reasons to stockpile. Just keep on your regular routine taking your medications.
And I would love to add one here before we get to more viewer questions. But, as you and I were chatting before the show, I have two little ones, and my son was running just an ever so slight fever. But obviously, we're all sensitive to this right now. And I had remembered reading that we ought to be careful about administering Motrin, or children's Motrin right now. What about that?
Yeah, so it's always safer in children if they have fever to make contact with their healthcare provider. Aspirin is the issue that's primarily the problem drug that we used to take for fever, but acetaminophen or Tylenol is safe to take, and generally the non-steroidal drugs like Motrin are okay to take too. But that quick phone call to the nurse at your pediatrician's office is something that will bring a lot of reassurance to you.
All right, Dr. Jones, thank you so much for answering my question there. Now we're going to take a quick polling break. We have our great team. Walter is leading the way in the production booth. So we've got more questions to cover. We're going to break for just a minute and show you this. We're just wondering what has been your favorite method of exercising during the pandemic, and we would love to hear from you. You can see there we're talking about going for a walk or a run, walking the dog, riding my bike, dance party, online workout, or other. And you can see right there from the respondents who have thus far made contact with us on this polling question that riding my bike has become very popular. And if you joined us later in the show and you missed our earlier question, you can start by texting AHA Live to 22333. And if you already registered, you do not have to do it again. You just go ahead and text your next answer to 22333 as we continue to monitor and share the answers from all of you. Dr. Jones, while we're waiting for a few more respondents here, what have you been doing personally to stay healthy and active and safe all at the same time?
Yeah, my favorite exercise is not on the list. And if you have, like I do, the luxury of having a yard large enough for a garden, then like me, working in the garden is a great way to get exercise and put healthy food on the table for you and your family during this time. And so these days we're eating lots of fresh potatoes and tomatoes and peppers and peas. In Mississippi, we love peas a lot. And it's a good time to be working in the garden and putting good food on the table.
I'm going to need a tutorial from you because I am not a green thumb. And so far, I have only had luck with growing rosemary, which is horribly embarrassing. And I can't even believe I am saying that live on the air. I want to talk to you just a little bit more as we're monitoring this. You can see a lot of folks are loving going out for a walk, run. Of course, the doggies, I'm sure that there's more people out there who have been enjoying walking their dog excessively, and the dogs are all getting spoiled. But as we hang on this for just a few seconds more, Doctor, I wanted to ask you, just in general, why is it so important to continue getting physical activity during this pandemic, and just keeping your body moving?
So exercise is an underrated prevention measure for heart disease and a treatment measure as well. Our bodies were designed to be active, and the lifestyles that we live these days make it difficult for us to be physically active. And so walking is a great form of exercise. It's what our bodies were designed to do. Riding a bike is great as well. And these days when it's fears, their fears to going outside, just remember social distancing, and you can walk outside safely. And if you need to, if you're afraid you're going to run into people, wear that mask.
Yes, and thank you for everyone who's writing into us. We're getting some really great interactions here. Rosa Cabrera says she's been loving to walk her dog and doing dance exercise classes online. We want to switch gears now to one more question and talk about relaxation, because this is also so important to relax the body and the mind. You can text in, let us know, what do you do when you're ready to slow it down and relax? You can see there, listen to music, take a shower or bath, meditate, watch TV, read a book. And doctor, I'd love to hear your thoughts on this. I know that you love to read.
I do love to read, and I just finished my friend John Grisham's latest novel. And if you follow Mr. Grisham on a regular basis, you may be surprised to see him out with a book in the spring. But I think the virus and people being at home has probably influenced his writing speed. And his latest novel is, like his others, a page turner. And I loved it, and would encourage you to read during this time as well to relax.
Do you actually read the physical book, or do you read it on your iPad?
Some of both. So Mr. Grisham is kind to send me a hard copy of his book each time he publishes one. And so I read his as a hard copy, but I usually read online.
And you can see there what the viewers and our audience is saying. A lot of folks listening to music to kind of calm things down, and reading a book is pretty high up there too, 29%. So that's great to see. I think probably there's a lot of you who are doing meditation, and I know we have someone who interacted with us who talks about how meditation has been a saving grace for her. It's good at least to see that watching TV is not leading the way, even though I'm a broadcaster, but I think that can tend to stress us out in times that are already feeling heavily stressed. So thank you all so much for continuing to interact with us here. Liz, Betty, thank you so much for watching. We see you, Liz. Let's see, Blue Smith, thank you for checking in with us. And Beatrice Mina, she says to this answer, all of the above. So good job. Thank you all for checking in. And now we want to continue. You ask, we answer. I'm going to move on here to our next question. And again, forgive me here because I'm doing this live time. I want to make sure I get all of your names and cities correct. This next question, doctor, is from Lee in San Francisco. Hi, Lee. And Lee asks, before COVID, I was scheduled for heart-related surgery, which was postponed. What do I need to know to stay safe and healthy while I wait? So it's a great question, doctor, from Lee in San Francisco.
Yeah, so Lee, this is an important question. There are a lot of people who have had elective surgery delayed because of the virus. And so the key thing here is, as I've said before about some of the issues, is to stay in close contact with your own healthcare provider, with your cardiologist or your cardiovascular surgeon, and be sure that if your symptoms change along the way, that you report those so they can make decisions. Elective surgeries have been postponed, but people who need surgery in an urgent or emergent way, the hospitals are equipped to keep you safe during the time of surgery. And so just stay in touch with your own healthcare provider, and they will guide you toward the safe time for you to come in for your surgery.
Very good. And now I want to move on to a question, and I hope I'm saying this name correctly. I believe it's Jackie from Redding, California. And Jackie asks, I have an inpatient procedure coming up, and I'm wondering, what do I need to do to protect me and my family once I go in? Will I be able to have a family member with me? Doctor, I know this is a hot topic. A lot of people have interacted with me on social media, and some of folks who I know directly who have had various procedures, and they have not been allowed to bring family members in. How do you answer that question?
Yeah, so again, you'll have to get some local guidance, but generally these days, visitors are limited in hospitals because of COVID-19. And I encourage people who are having elective procedures during this time to arrange for one family member who will spend time with them, and to be sure that that is a family member under age 65 and someone who does not have chronic health conditions. So you want someone who wouldn't be at high risk for big challenges with COVID-19 if they did contract it when they were in and out of the hospital. And so you likely will be limited to one visitor, if any visitors at all, and choose carefully. If you're older, it may be that it can't be your spouse or your regular partner who would come, but choose someone young and healthy to support you during your illness.
Doctor, you're sharing such important information. Thank you so much again for agreeing to do this for us. And Katrina from Fort Collins, Colorado asked this question here. I am a recent stroke survivor and was meant to begin a stroke rehab program, which has now been delayed. What should I be doing until it is rescheduled?
So really unfortunate timing for you. And let me say that rehabilitation after a stroke is critically important. And so there are two places you can go for good information. One, your own healthcare provider. Even though they were going to send you to someone else for your rehab, they will know the kinds of things that you need to do. And so they can give you direction on the kind of exercise that you can do, the pace at which you can change that. And so stay in touch with them. And then if they do make that referral to a therapist, make that contact with them by phone or by video conference and begin the things that you can do at home. Most of the things that can be done in rehab after a stroke can be done in the home environment, but you'll need professional help in guiding you the pace at which to do that. I've seen so many patients who had strokes make such remarkable improvement up to a year or two after their stroke because they did stroke rehab regularly. And I just encourage you not to let the virus keep you from being able to get the treatment that you need after your stroke.
Thank you, Doctor, and thanks again to Katrina from Fort Collins, Colorado, and we wish you all the best of luck with your health, of course. We continue to hear from a lot of American Heart Association supporters and audience members. Peggy Hill, responding to the question about relaxation, said, I'm surprised that exercise isn't listed as an activity to reduce stress or relax. I know we touched on the exercise, Peggy, so we hope that you are staying strong and healthy, getting some fresh air, and taking time for yourself during this pandemic. Keep the responses coming in, and we certainly appreciate interacting with you during these live shows. Really, that's the whole point of the show, is to take your questions straight to the experts. Doctor, I just want to say thank you so very much for spending your time today. I know how busy you are. I would love to leave you with the opportunity to share a few final words of inspiration with the audience. This is a scary time for a lot of people, and you have practiced medicine for many, many years, and you're such a caring physician. What would you like people to know?
So take care of yourself. This virus, there's so many unknown things. This virus is mean and sneaky. Don't go too quickly, especially if you have heart-related health conditions or stroke-related health conditions. Isolate yourself, wear that mask, stay away from crowds, and take all of your regular medications for preventing cardiovascular disease and treating cardiovascular disease. Thank you all for being a part of this cast today, and thank you for the privilege of being a part of your healthcare today. Thank you.
Thank you, Dr. Jones. And a lot of the audience members are saying thanks as well. I'll read one real quick. Blue Smith, I love that name. Blue Smith says, thank you so much, Dr. Jones. Take good care of yourself, sir, and thank you again.
Thank you.
And now we want to move on to our weekly health hack. Health Hacks is brought to you by the Stories of the Relentless, the American Heart Association's new podcast. It is terrific. I encourage you to check it out. You can find it on heart.org, iTunes, Spotify, and Google Play. Go check it out and subscribe and share your thoughts with us, and share it, please, with your friends and family or someone who you think might benefit from this terrific content. And this week's health hack comes to us from Nora out of North Carolina. Nora has has learned to meditate during the pandemic and has 2 tips to get started. You can see them on your screen, and these are really great tips. Set a consistent time aside. Every day at 12 noon, Nora meditates for 10 minutes before lunch, and she's very consistent about that. Download meditation music to your computer or phone so you have it all ready to go, and you don't have to go searching for something you like each time you are ready to meditate. Nora, thank you very much. Take good care of yourself. And remember, we feature a new health hack each week. So if you have a great healthy hack you would like us to share, you can share it with us. And let me make sure I give you the right information here, heart.org/housecalls, heart.org/housecalls. And maybe next week you will see your hack live on the show. And to wrap up today, we want to bring it back to the audience to get some of your final thoughts during What Would You Say? And we're going to be taking a look here live. You can go ahead and if you want, at this point, we would still love to hear from you. You can text and answer 22333. So here's the question. In the last 30 days, which of the following ways have you interacted with the American Heart Association? This is important information. They always love to hear how you are connecting with them and how you prefer to connect with them. You can see visited the website, read an email newsletter, social media posts. They are very active on social media, attended a virtual event, participated in a virtual workout, watched live stream events like this one here today or other. And we want to know in the last 30 days, how you have interacted with the American Heart Association. So you can see there various responses coming into us on screen, and we appreciate all of you writing in as well. Joanne Velasquez, thank you very much for tuning in. We appreciate you being here. Kathy Lee Lewis, again, she's saying thank you to Dr. Jones, who is just absolutely excellent. So keep your responses coming. The whole point of this broadcast is to hear from all of you, share your thoughts, your questions, and your responses. You could see that a lot of you have been watching the live streams. This is our second episode today. So we really appreciate and value your feedback. And our final question of the day addresses what you really want to hear about on this show. Again, the show is all about you, the audience. What topics are important to you, and what are you interested in hearing us discuss? Tell us which of these topics would you most like to see featured on one of the upcoming episodes. You can see there the CARES, Coronavirus Aid, Relief, and Economic Security Act. Would you like us to talk more about that? Or would you like to hear the experts weigh in on the role of a caregiver? So those 2 topics are both under consideration, and we definitely want to hear from you so we can bring you advice and information that benefits you and your loved ones the most. Continue to interact with us, and we will be sharing more topics, more of your health hacks and your questions when we come back live next week. That is all we have for you today. We want to thank you so much for joining us for House Calls, Real Docs, Real Talk, and we appreciate all of you for interacting with us. I've got my phone, my iPad, I'm watching all of your responses, and you guys are just great. And Blue Smith is back with us right now. She says, this is my first live stream, but it will not be my last. Blue, thank you so much. We really are doing this for all of you. We want to bring you up to the minute, the most credible information straight from the experts like Dr. Jones. And please join us again, same time, same place next week. For now, I'm Carrie Pena. Stay healthy and take care.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at